Hello, welcome. This is Diamond Fernandez with the HeartFit Clinic, your leaders in heart health. And today I want to talk to you about the benefits of exercise. To your group, I know you guys are going to be starting a great program, and talking about the benefits of exercise I think would be timely right now. If I were to bottle up the effects of exercise and put it in a pill, it would be the most prescribed pill in the whole world. That's how many benefits it has. Especially, things that we can do regularly, walking, and we know kind of what to do, and I'm just going to give you some quick guidelines to help you out with that. But if I were to bottle up all the benefits of exercise and put it in a pill, it would be the most prescribed pill in the whole world. It has that many benefits. From a cardiovascular perspective, it is, in my opinion, the best pill that you can do for your heart health and your arteries. It prevents heart disease. It reverses heart disease. If you are overweight, if you have high blood pressure, if you have diabetes or high circulating blood sugar, exercise is your solution. If you want to prevent cancers, if you want to prevent all the bad diseases out there, exercise is so important. It's one of the most important things that you can do. And so I'm going to quickly talk about some guidelines because I think it's important to do that, and especially if you're going to start a walking program and start to do it at different points in the day. Firstly, you want to don't just go out and exercise. You want to just have a little bit of a warm-up phase, a few minutes, just to get up to a pace where you are breathless. And you want to stay there for a consistent amount of time, and then, of course, have a little slow down from that. So get up to that pace and then cool down from that pace. And just some precautions to be aware of. I always like to talk about it, especially, time of years, and where we live, we have definitely a lot of seasons. And so when it's cold outside, your heart works a lot harder to warm itself up. So in that case, you want to make sure that you dress appropriately, layer up with clothing, maybe throwing a scarf over your mouth so you're not breathing that cold air directly. So your heart works a lot harder to warm itself up when it's cold outside. The opposite happens when it's hot outside. When it's hot outside, your heart works a lot harder to cool itself off. So you want to exercise, maybe not at the hottest point of the day, but if you are going to, maybe wear a hat, especially lunch hours, maybe wear a hat or loose-fitting clothing, and make sure you stay well hydrated. So those are some important tips to be aware of. Hydration is going to be very important. Also, you want to make sure you fuel up. You want to have some energy on board before you exercise, or obviously your sugars will be too low, and then you're not going to have the energy to do what you're obviously intending to do. That's supposed to be a benefit. So those are some things that I'd like to get out and do. Exercise, talking more about the benefit side of things. From a risk factor perspective on heart health, like I said, hypertension, high blood pressure, diabetes, obviously overweight. We know those are big risk factors to heart disease, and if we can exercise, we improve the inner linings of our arterial wall, and it minimizes the effects of plaque building up, because no one wants any plaque. Am I right? So there's some a few quick tips for your group to go out and exercise. I wish you all the best. If you're concerned about your heart health, if you don't feel quite as safe to exercise, then come see us. I can talk to you personally, or obviously can do one of our assessments if that's what I recommend. But I'd be happy to chat with you further and give you some further recommendations. But this is, of course, the general guidelines to help everyone just get out and start moving, because it's going to be important. It's going to prevent disease. It's going to allow you to live longer, and I promise you that. And all the research shows that. It's just obviously setting that discipline to be able to do what you were able to do. And I can't stress enough, I think it's getting up there now. I think 80% of the population is overweight, so has increased waist girth or obviously abnormal body weight. And I think it's interesting because we grow up physically, we grow up mentally, and with no disrespect, sometimes we don't grow up emotionally. And we get a little bit spoiled, and we are like a spoiled child trying to have what we want to eat and not have to exercise. Well, I'm here to tell you that if you can start to set some daily disciplines on and some good habits, it takes a while to form these habits. These little neural pathways in our head get all we're wired to kind of work the same way and drive the same way to work, and we can do that automatically. If you can get automatic with those good healthy habits, you're going to see great long-term benefits. If you are wired with those unhealthy habits, well, you're going to end up down that path of obviously problems, and it could be cardiovascular, metabolic diseases, or even cancers. So again, if you have any questions, I'm happy to help you further. I just wanted to give you some quick suggestions on the benefits of exercise. make sure you take your daily dose. Here's Diamond Fernandez with the Heart Fit Clinic. Live happier, healthier, and longer.